Okay, welcome everybody into the John Howard Week 2024. We're joining you here in PEI. It's Monday, March 4th, and it's about 12 p.m. We're excited to be here with you this week and to talk about a variety of topics. Today we're going to introduce John Howard Week and talk a little bit about some of the services here. Joining me is Caroline.
Hi.
We've got Caroline here, and we've also got Keith with us.
Hi, folks.
Okay, so why don't we start off? We'll just sort of give a quick overview of who we are. So I'm Josh Constantinou. I work here at the John Howard as the Coordinated Access Coordinator, and I will be here as the host this week. So you'll be hearing from me on a daily basis with a variety of other folks, depending on what that topic is and what day it is. Turn it over to you there, Caroline.
Sure. Hi, my name's Caroline Davison. I am a member of the Board of Directors for the Prince Edward Island John Howard Society. I'm currently the Vice President and I chair the Policy Committee. And I'm just excited today to be part of launching John Howard Week, and I hope everybody has a great educational experience learning about our services here in PEI.
Thanks, Caroline. Keith, do you want to jump in?
Yeah, thank you. My name is Keith Hillier. I'm the Executive Director of the John Howard Society of Prince Edward Island, and I'm just excited to be part of John Howard Week and to get things rolling.
All right, thanks to both of you there. So in terms of kind of what we've got going on here, we'll be doing a daily lunch and learn. We'll be coming to you live each day around 12 o'clock. You can find us on our YouTube channel, which is John Howard Society of PEI. If you want to go on there live while we're on, you can go on, and there's actually a spot at the bottom to write comments. So we'll be keeping an eye on those throughout the podcast. You can also watch this after it's happened by going there. All the live stream videos will automatically stay on our YouTube channel, and they'll be there moving forward. There's also information on our website, which is johnhowardsocietypei.com, and on our Facebook page. Okay, so let's start off with a little bit about John Howard. Caroline, do you want to give us a little bit of background? And Keith, feel free to jump in as well.
Of course. So the John Howard Society of Prince Edward Island provides a range of services to individuals who may have interacted with the criminal justice system in the past or presently. We also have programs that deal with the issue of homelessness, and we provide kind of employment services and a variety of different programs. We have, I believe, 3 different office locations now. Our staff has expanded quite a bit over the past 2 or so years, and we've also expanded some of our program offerings during that time, kind of outside of the traditional, dealing with programs to assist those who have been involved with the criminal justice system. We've expanded that to include a lot of programs to do with homelessness and helping to connect people with housing. Essentially, our kind of mission as an organization is envisioning a place where everyone can contribute to a safe, healthy, and just community. So that's really at the core of all of our programs and services that we provide.
Fantastic. Keith, is there anything you wanted to add on to what Caroline said there about John Howard?
I would just suggest if people wanted to get a good sense of the John Howard Society and the types of programs we have, that they could go to our website. And on the website, there is a copy of our strategic plan that outlines our focus, and also there's some program information and some contact information should anyone wish to contact one of our staff. Either here in Charlottetown or in Summerside.
Fantastic. So I think that gives everybody a pretty solid background as to sort of John Howard from a more global perspective. I think now we'll move along to going through some of those programs. I think it's helpful for people to get a bit of a sense of the different programs and services that we're offering. As Keith alluded to, you can find lots of details on the website. So if you have more questions or want more information, you can go there afterwards. But why don't we start by just giving a bit of an overview of each of the programs that we have here. So let's start out with you sort of alluded to that homelessness and housing has been a big part of that. So under our Reaching Home umbrella, we have several different programs and services. Let's talk a little bit about sort of the wraparound housing services, because I know those are the sort of frontline on the ground folks out in the community doing that work that visibly you'd see out there on a day-to-day basis. So let's start there. And if either of you have anything you kind of want to add on that, and then I can certainly speak to that after that as well.
Well, this is Caroline here, and I may defer that question over to our executive director, Keith. Keith, I think you may be better placed to tackle that one than I would be.
Sure. With regards to the wraparound program, the key objective is to get people housed and to help them make a transition from homelessness, or one might say near homelessness. And the program does provide a number of things, one of which is financial support, where in fact we do help people with things such as a security deposit. We help people with some basic furniture, but probably more importantly is that we provide them with case management services. In other words, we help them be successful. We interact with landlords and with the clients, and the as I mentioned, the goal is to have people housed and for them to stay housed, to work with them, to help them with things such as budgeting, help them with understanding, what the roles and responsibilities of a tenant are, and also to ensure that there's a good working relationship, good professional relationship with the landlords. And in this particular segment, I would give a special shout out to veterans and the former members of the Royal Canadian Mounted Police, starting in April 1st, just less than 30 days from now. We will be providing a specialized service in the wraparound area to former members of the Canadian Armed Forces and to former members of the RCMP. So in addition to our general programs, we will be reaching out to those two communities that I just mentioned to provide additional services if they're required.
Awesome. Thanks, Keith. Thanks for bringing that up. I think that's a very exciting program and service that we've been working towards for some time. And it's great to see that we're kind of less than a month away from that kicking off and going into action here. As you alluded to, we've got that specialized program along with our general programs across the different counties. So we do have a dedicated worker for Kings County, a dedicated worker for Prince County, and a dedicated worker for Queens County. So that's something that we're really happy with, that we have the opportunity to service folks all across the island. In addition to the frontline folks that are out there doing the difficult, rewarding work that happens on a day-to-day basis, we've got some behind-the-scenes stuff that happens. So we've got Jane, who's our data analyst and admin, who takes care of a lot of our stats, which helps support some of the funding pieces and the programs, which is also ties into Amber, who does a lot of the work in terms of funding and supporting community partners and collaborating with them. And then myself as the coordinated access coordinator, who helps to operate the coordinated access system for PEI with matching individuals experiencing or at risk of homeless to those services and programs that are available. So I think that while those might be a little more hidden, they're equally important and as pairing with the frontline services to keep the operations going on a day-to-day basis and help everyone. Anything either of you wanted to add on any of those services before we move along to the next program or service?
Nothing for me. No, I think you both did a really great job covering our existing programs. Thank you.
Awesome. Okay, so along with our housing services, we also have employment and pre-employment services, which are offered to individuals who have a goal of employment and getting back into the workforce. Oftentimes, those individuals are running into certain barriers that might be existing for them. Keith, I don't know if there's anything you want to highlight or elaborate about those services.
Well, I think one of the key aspects is actually working with the individuals and having a frank discussion about what the art of the possible is in terms of their experience, their training, their education, and helping them develop sort of a plan or an engagement plan for employment that would be suitable. Or in terms of training programs, there are many training programs that are available in the community to which the clients may not be aware. So a lot of it's about awareness. It's helping them with the preparation of a resume, doing some coaching in terms of preparing oneself for an interview, in terms of the types of questions they might be answered and how they may present themselves in an interview. So it's really to give people an opportunity to move forward. We work on the basis of helping everybody reach their maximum potential, which it varies from individual to individual. But in many ways, it's a coaching process, and hopefully people can find a job, and those who can find employment are less likely to run into challenges regarding homelessness.
For sure. Yeah, I think it's a great opportunity to help folks get back on their feet and contribute and see some improvement in their life in a variety of ways. It's also worth noting that both of these services that we offer amongst the community and island-wide are also offered to individuals who are incarcerated. I think that's a key aspect of the services that we provide. And so they have access to those same programs in the same way that they would if they were in the community. Keith, I don't know if there's anything you want to touch on that aspect of it, or Caroline, if there's anything you want to add.
No, I would point out that we do go to the provincial correctional center and make our services available to people who are incarcerated. They're able to make an appointment to see a John Howard caseworker, and the goal is to assist them for their transition out into the community, and hopefully with some opportunities, whether it be in training, whether it be in job search, it would help reduce the rate of recidivism. Unfortunately, when people are sometimes released from custody and they don't have a place to live, they don't have a job, they don't have any source of income, unfortunately, the rate of recidivism is considerably higher for those individuals than those who are going out into a stable work environment with a place to live. And that's one of our key goals for that program, is to connect with with the individuals prior to their release date.
For sure. Yeah, I think it's great that there's an opportunity for them to get access while incarcerated, so they don't have to wait until they get out into the community to get that support that they might need. Okay, so we're moving towards the end of our introduction period, and we'll be bringing on Ali Ryder here shortly to talk about data collection and pit count. I'll open it up for any sort of final thoughts or comments here. Caroline, I don't know if there's anything you want to talk about from the board perspective.
Sure, thank you. I think I'd really just like to highlight the dedication of the John Howard Society staff and executive director in organizing this week, but also just in the services that are provided on a daily basis. We have a wonderful staff, and I think this week will be very educational. So I hope that a lot of people tune in and learn a lot, and we're always willing to connect with the broader community in Prince Edward Island. Partnerships are very important. So please feel free to reach out to us at any time if you'd like to get involved or learn more about the services we provide. Thank you.
Thanks. Keith, anything you want to add before we bring Ali in and close out the introduction?
Just probably a key message for our audience, if there's a takeaway. The John Howard Society of Prince Edward Island exists to help islanders, and that's our true raison d'etre. While we talked about some programs, at the end of the day, we're here to provide help to islanders who need it.
Fantastic. Thanks, Keith. Thanks, Carolyn. All right. Well, thank you both for helping me with the introduction. I appreciate that, and I'm excited for the rest of today's episode and the rest of the week. Thank you both for coming.
Thank you.
Okay, so we're going to bring in Ali now that we've finished the introduction period. Hopefully that gave you a bit of an idea of what John Howard does and some of the services we provide. So we'll check in. Ali, are you able to hear us there? Is everything going okay?
Sure am. Can you hear me?
We can. Fantastic. Thank you for coming to participate with us here. I'm excited to have you as a part of our podcast today and part of John Howard Week.
Well, thanks for having me.
Yeah, fantastic. So I thought maybe we could just start off. I've kind of already talked a bit about what I do here as part of the introduction, but I wanted to open the floor to you to sort of chat a bit about what you're up to and what you bring to the data collection world, as it may be.
Yeah, thanks so much. Okay, so hi everyone. My name's Ali Ryder. I am the owner and operator of Acre Consulting. So I have been working with homelessness for about a dozen years. I am an urban planner, but I got my start doing stuff related to actually point in time counts. I did my first ones in like 2011, 2012, thereabouts. But I have been, as I mentioned, around for a while. I've been doing Acre Consulting for about 7 or 8 years. And what we do here, what I do, is I help communities use HIFIS. So if you're not familiar with HIFIS, it is a database, a homelessness management information system that communities can use to share information and collect data about homelessness across a community. It's put out by Infrastructure Canada, the Canadian federal government, and it's free for communities to use. And so what I've been doing for the past 8 or so years is helping communities to use it effectively, ranging from training to reporting out and configuring the software properly and stuff like that. But as I mentioned, I got my start in pit counts over a decade ago.
And that's a great segue into our later discussion about the pit count. We'll certainly get into that in a little bit of depth, as this is the year for the pit count, and we have ours coming up in the fall. So I'm glad to hear that you'll be able to share some expertise about that. You touched on HIFIS, which is sort of the bridge that brought us together. We get our primary support for HIFIS here on PEI from AHANS, which is the Atlantic Housing Association of Nova Scotia. And so you've been helping do some consulting work with them, and sort of as a byproduct of that, indirectly helping us here on PEI, and somewhat directly moving forward, helping us as well.
Yep.
So I wondered if we could sort of go a little more global for a minute. I think still within the realms of HIFIS and pit count, but I wanted to just talk about data collection and kind of the importance of data collection, particularly the way that the things are moving around data and analytics in the industry of homelessness and housing.
All right. I don't remember the quote. I really should have looked it up, but there's a great relevant quote in this area that's about that which gets counted is that what matters. I'm sure I'm totally botching it, but basically, if you can't count something, then if you're trying to demonstrate a problem exists, but you don't know anything about the problem, then no one is going to believe you. Or even if they believe you, they won't know the scope or the scale of the problem or the type of solutions that are necessary. So historically, there has been a giant gap of data related to homelessness. If we think like a long time ago, then if you wanted to understand, how many women there were in Charlottetown, then you would go to the census. But censuses typically don't include people who are homeless, because if you think about it, it gets mailed out to people's houses. And so if you don't have a fixed address, you often get skipped. So even our primary biggest source of population level data tends to exclude homelessness. And another problem is that historically, different agencies may have been competing against each other for funding. And so there was a disincentive for anyone to share any data. And so the best that you'd probably get would be, oh, there's 3 different shelters and they all report that they served 100 people last year. But we don't know how many of those are being double counted. We don't know if that means there are 300 homeless people or just 100 homeless people who visited all 3 different shelters. And so there's been a big gap in data historically. Now, over the past couple of decades, we've started to try to address this problem. And one of the ways we can do that is through a point-in-time count. A point-in-time count is when basically you get a bunch of volunteers and try to cover the whole city or geographic area all in a small amount of time. So you send volunteers out to the streets and try to survey people that might be homeless. And so you get a point-in-time snapshot of everyone who might be experiencing homelessness on one day. Another way that we can try to fill the gaps of homelessness data is through using a collaborative data sharing system. And that's where something like HIFIS or an HMIS comes into effect. So HIFIS stands for the Homeless Individuals and Families Information System. And so at its core, it is, a database where all of the different service providers within the community might be using it to record information about the people they've served, who stayed in my shelter last night, who are the clients that I'm assisting with case management services. And if clients agree and consent to data sharing, then we can share data between the different service providers to try to coordinate services. And between the PIT count and having an HMIS in place, then we can start to see a lot more data about homelessness, which means that we can understand the problem better and make more appropriate solutions. For example, we could start to demonstrate that maybe there's a lot of immigrants or refugees coming in, and there might be a special need for services assisting that specific population.
Fantastic. Yeah, I think you hit on a handful of key things there. One of those being sort of the data transparency piece. I think it's important that you touched on this idea that people are now able to input their data, and there's a transparency to that if we can see it. And so you've got the information stored in that homelessness management information system, in this case, HIFIS. And we've sort of taken that to the next step here at John Howard, which I know some other communities have also done. And we've created a dashboard through our website to highlight some of those numbers and share those numbers on a biweekly basis. Which I think is key for the community as a whole to be able to get some of that information. You also touched on the idea of sort of data accuracy, where you've got multiple different sources where the data could come from. And so this streamlines it in a way that there's not that duplication of data, and we are getting it. And so if somebody goes on to HIFIS and says, oh, here's John Smith, and I'm going to add him, and he's already there, then they can just add their version of the information. It doesn't create a brand new John Smith. And so there's not multiple John Smiths.
Yeah, that's right.
In terms of, you touched a little bit on how it can help make recommendations and how it can help with uncovering some of the issues. Let's kind of chat for a minute about how it can drive actions or drive change or policies. So sort of how it goes from the, this is information we've collected and are now aware of phase to the, let's implement some changes or solutions or take action stage.
That is a great question. Sorry, I'm just taking a pause to think.
Sure.
So one of the groups that I work with is the Canadian Alliance to End Homelessness, and they have a campaign called Built for Zero, which is all about helping communities to try to get towards zero chronic homelessness. And some of the data metrics that they ask communities to collect and look into is really great. They want you to look at your inflow, how people are becoming homeless, and your outflow. How are people exiting homelessness? And so if you're looking at those two metrics just on their own, then you can ask questions like, what are the pathways that people are becoming homeless through? Are you seeing a lot of discharges from correctional facilities? That might be an example. Or are you seeing discharges from hospitals? Or is it a lot of evictions? If it's a lot of evictions, is it a particular reason for eviction? And so when you can have the data at a system level, if you're looking at all of your shelters and everyone who became homeless, say last year, and you're saying like, wow, I don't know, 20% of them were a discharge from from foster care. Once again, I'm not picking on anyone. I'm just sort of making up examples. But if you see that there's a large population that all has a similar kind of story, then that can often point to a gap in services and say, hey, there might be an area here where we can do something differently about it. Is there a way that we can have better communication and try to prevent, discharges into homelessness, as an example?
Yeah. I think that makes a lot of sense. And I think that's a great place to start in terms of taking a look at how are people entering homelessness, because it can create that upstream type of thinking where you can then look and say, okay, well, if we know, as one of your examples from corrections, let's say, we know people don't have a plan in place when they're leaving corrections. What can we do as a community to have a transition or discharge planning type position or role embedded into the correctional facilities to help reduce that incidence of homelessness? So I think that's a good idea in terms of how you can garner information from how people are entering homelessness.
Another example that we could look at is how long people are staying in shelters. So shelters are intended to be an emergency solution. If you see someone staying in shelters for 6 months or longer, then that speaks to a kind of bottleneck. People are unable to exit the system. And so one of the things you can do is compare the average length of time people are spending in shelters for different population groups. So one thing that you could look at, for example, is are families, particularly large families, spending longer or shorter in time in shelters than, say, an individual or a couple? And what we often see is that there's just not a lot of affordable apartments available for larger families. So there tends to be a bottleneck there. And so you can compare these different groups and say, oh, these people are having more of a difficult time exiting shelter. It's probably because there aren't appropriate units available. Perhaps we can invest resources in trying to build more housing of a particular type or make some arrangements to, assist these people with a rent supplement to access housing. So one of the other things that we can look at then is comparing different groups on a metric like length of time in shelter.
Nice. Yeah, that also makes a lot of sense. And that comparison piece is really helpful. Like you said, there's different populations, different groups, different factors that might be playing in. And I think, again, that helps you delve a little more into the specifics. Sometimes I think it's sort of there's homelessness in general, and you kind of look at it as from a general perspective, but you need to get into the nitty gritty and see what's going on, as you said, within different populations or circumstances that might be indicative of where you can invest your time and resources. In terms of HIFIS specifically as a database, can you talk a little bit about some of the key functions or some of the ways in which it can be helpful as it pertains to coordinated access and homelessness and housing?
Sure. I think HIFIS is great as a kind of a full service database. And what I mean by that is there may be some some service providers within the community that have a great tool that they use for case management. Some shelters might have a tool that they would prefer to use for book-ins, book-outs. Probably food banks are also, have their own separate software that they'd like to use. One of the advantages of HIFIS is that it kind of does all of the things that you would need when you're looking at a coordinated, like a system-wide tool. So it will allow you to do case management in HIFIS, record shelter book-ins and book-outs in HIFIS, record food bank provisions, do outreach, do shelter diversion, all of the different types of services, our service providers can use the same tool. So I think that's really where it shines. What you would like to see is all of your service providers in the community agreeing to share data, which is part of, it's a necessary ingredient for having a functioning coordinated access system. And then HIFIS serves as the database, your shared information repository. So every client will have a unique file. And since the clients are likely to be accessing multiple service providers, it's a way for service providers to share data about their mutual clients together. So you could tell that a particular client that's visiting the drop-in center today, which shelter they were visiting last night, or if you are a caseworker and trying to figure out where my client might be located, you can look that up. And so it's a great way for staff to save time. In the olden days, maybe every shelter would do their own separate intake. And so collectively as a system, you were losing all of the time where if a client had to go to 3 different service providers, they'd do the same paperwork 3 times. Now they only have to do it once. The staff are also saving time, and the client doesn't have to, tell their story every single time that they go somewhere new, which can also avoid, re-traumatization. And because you have this sort of central database, it allows you to, look at system level data, which has really been missing historically. I'm not sure if I answered your question. I might have talked around it.
That's okay. No, I think that's great that you've sort of outlined this idea that there's a layered benefit. So you've got, like, on an individual level, you've got a benefit that client then avoids that re-traumatization. And because of that data sharing and transparency, they don't have to retell their story and complete multiple intakes. You talked about on kind of an organizational level that you can see what's going on within the individuals that your particular service is servicing and providing support to. And then you talked about the system-wide at the end there, how you can start to see what's going on within the system as a whole.
Yeah, that's a great summary. Thanks.
No problem. Yeah, so I think that's helpful that you've sort of laid that out, that it does have those benefits. I think highlighting that it's helpful for the individuals is one of the biggest pieces, because I know anytime that your data goes onto a database as an individual, there's thoughts around like, how is that beneficial for me, or why would I want my data on there? And so I think you've done a nice job of sort of explaining some of that, of how it's beneficial to the individual, and why having their data on there is helpful, and could save them having to do multiple intakes and retell their story over and over. Anything else you want to add in terms of HIFIS or data collection before we chat a bit about the PIC count?
Just that one of the things that I think is really interesting about communities using HIFIS is more and more communities across Canada are adopting it system-wide for a component of the coordinated access system. So it's really starting to be very interesting that you can speak with a staff in another community and have that kind of mutual understanding. Or even if you go speak to someone from another community and they tell you about a cool report or dashboard or visualization that they've developed, it's often the case that you can borrow that and just plug it into your own data. And so there's an option now that it's becoming more and more widespread for like cross-country collaboration. Not saying that the data within your database is going to be shared across the country, just that people are figuring out cool ways to use the software and cool ways to pull data out. And so we're learning a lot about what the most meaningful, visualizations and ways to present the data are, which is kind of neat. And the software is still in development. So every year we're seeing enhancements, new modules being added.
That's awesome. And I think that's a great point. You and I were part of a HIFIS training webinar promotional week there a few weeks ago. And that was kind of the biggest takeaway that I saw there, was all the great things that people are doing in other communities that could be applicable to some of the work we're doing here. And I think that's a very interesting piece of it, is that by using this database, it not only offers some of those benefits that you chatted about from an individual and organizational and system level, it now also sort of allows you to speak the same language, so to speak, with other communities, and to nationally be a part of that movement and part of those improvements and gain access to that.
Absolutely.
Okay. So you touched on how PIC count was sort of your bread and butter for a period of time, which I think is fantastic as we move into that portion of the conversation. As I alluded to, the PIC count is upcoming here in the fall. We'll be doing ours here on PEI. We're excited to be expanding it. It's only ever occurred in Charlottetown and Summerside. And this year it's going to also include Montague area as part of Kings County, which is the third region here. So I guess just if you want to sort of introduce the idea of the PIC count, a little bit behind, like what's behind that and why we do that. I know you touched a bit about that earlier, but yeah, anything you want to sort of throw out as part of that piece.
So a point in time count, PIT count stands for point in time count, is sort of like a census. A census, occurs trying to capture the entire population, and it's done at on a particular day. So we try to do the same thing, but related to homelessness. So I did allude to it before. Usually it's done with a lot of volunteers that are assigned a particular area of the city, and they're instructed to walk around and approach people who may be homeless and do a survey with them. The first couple of questions are screening questions to determine if the person is actually homeless or not. But the survey will have a bunch of questions, many of which are nationally coordinated, and some of which could be locally added in addition. And so the idea is to try to reach everybody who's homeless at the same time. One of the reasons that we do it all in one day is to try to prevent duplication. and to try to make sure we sort of get everybody. Sorry, I just totally lost my train of thought. But the goal is to get a series of these surveys that have information about everybody that we're capturing. Now, one of the key differences between a PIT count and having this shared database is that a lot of people experiencing homelessness may be reluctant to participate in a coordinated access system. So they might not, be willing to consent to you collecting their name and having lots of data collected about them. But the point in time count is anonymous. And so we're hoping that an anonymous survey allows us to reach people who might not even be part of our coordinated access system. So the goal is to figure out on a particular day in total how many people are experiencing homelessness, and then hopefully also get some data about that population via that survey.
Exactly. Yeah, and I think the biggest piece that you touched on there, maybe two of them. One is that the survey questions are standardized for the most part. Like you said, there can be local additions to that, but the same questions are being asked all across Canada, which again allows for that connection when you're looking at it more globally. And then the piece that really stands out to me is that the PIT count allows us to access individuals that we might not otherwise be able to access on a day-to-day basis. As you said, the anonymous piece can provide some ease and comfort. And sometimes we just are making more of a concerted effort, if you will, or have more of a strategic plan to capture everybody in every possible place all at one time. So I think it is a great pairing to the data that we have on a day-to-day basis and to the individuals we regularly connect with, to help that create that full picture of what's going on in terms of homelessness and who's experiencing that and some of the details around that.
Yeah, and I forgot to mention, thanks for picking up on that. The same questions are being asked across Canada, and this is a nationally coordinated PIT count, which means that every community that receives federal Reaching Home funding is required to do a point in time count. The data is all submitted up to the federal government, and they will do analysis on it and publish the results. So this is our best source to get a national picture about homelessness.
And to add to that, I know that most communities, I think all communities, have the opportunity to follow up the sort of one-day blitz with some additional surveys for a period of time, usually up to around 30 days. Do you want to touch on that for a minute?
Yeah, so I think what you are referring to is sometimes termed a period prevalence count. And so this is a effective method when you have like a rural area or an area that's more spread out, where wouldn't be feasible to have all of your volunteers like literally walking and covering the whole area all in one day or in 8 hours or 3 hours. And so in more rural areas, one of the things that they might do is keep the survey period open for a few weeks instead of just being one day. And then what you might do is have service locations that are instructed to complete a survey with everyone that comes into their service location over a period of time. It's harder to deduplicate that way, so you need to be a little bit more diligent about screening. But it's one of the best ways to estimate the prevalence of homelessness in rural or like less populated areas.
Yeah, and I think you described that well. And as it pertains here on the island, we certainly have a lot of rural areas. As I alluded to or mentioned previously, Kings County and Montague area wasn't even being captured up until this year. So that's a significant change that we're excited about. But certainly there are some rural spots where there may only be a handful of individuals in that area. So having an opportunity to capture them in the following week, 2 weeks, 3 weeks, whatever that might be, is a great option to have for communities such as ours, where we've got folks that are harder to access. Okay. We've chatted a bit now about the data collection. We've gotten into some of the things around HIFIS. We've talked about the pit count specifically. Um, Anything as we sort of move to the end of our time around kind of where we're at in the data collection in this movement of these services, or kind of tips moving forward or thoughts moving forward, or where do we go from here? Anything in that sort of realm of conversation you want to talk about?
Oh man, that's such a big question. Well, I think it wouldn't be a surprise for anyone to hear me say that the state of homelessness is pretty bad right now. Like the pandemic hit everybody hard. And so across Canada, homelessness is, significantly up from pre pandemic levels. Um, and to some, that might be a little discouraging that at the same time, a lot of communities have been doing a better job of collecting data and a better job of trying to coordinate services. And despite all that, the rate of homelessness has still gone up. But I would have to say that these are separate things. A lot of the time, people might say, "Well, we've been trying these things and they haven't worked." But I think there's just a lot of external factors going on. So I would like to take the time to say that we absolutely can't solve the problem if we don't know the scope, the scale of the problem, and we can't solve the problem if we're not working together. So I would like to absolutely encourage anyone who's listening to try to find ways to coordinate, to work with other service providers and partners that you may not have traditionally worked with. Come up with some creative solutions, and just use the tools that are available. And one of them is HIFIS, but it's not the only tool that exists. Working together is often presents a lot of new opportunities that you may not have considered previously.
Thank you for sharing that. I think that's really good information and good sort of encouragement around, as you said, there is this sort of dynamic whereby, and we experienced it here locally when we drastically improved our data collection accuracy and our overall efforts, and it caused our numbers to go up. And so there was a period, and even may still be a period, of sort of this leveling out process of saying, what do those numbers actually look like, given that we just improved our data collection versus people are continuing to experience homelessness. And so I think that's a kind of an interesting thing that we've been working our way through locally. And I think your point around collaboration and creative and innovative solutions rings true with the theme for this week, and sort of every week, in terms of how as a community we can work towards reducing and improving the situation that's going on for folks.
Yeah, sounds about right.
Okay, well, thank you so much for spending some time with us. Really appreciate you coming on. Is there anything you want to finish off with or add to the conversation? And then do you want to just take a minute or two there and sort of chat about how people could find you if they're interested, or what services you might be able to help people with?
Yeah, sure. Well, first of all, thanks for having me. And just to wrap up, so my name's Ali Ryder. It's Acre Consulting, ACRE Consulting. You can find me at acreconsulting.ca. Most of the services that I offer are more for like community level organizers or managers who might be interested in finding solutions for their organizations. So I can assist with HIFIS training. I can assist if you're having trouble trying to pull out some data, if you need to report on something. Those are the kinds of things that I would often help communities with.
Awesome. And we're excited that, as I said off the top there, directly and indirectly, that you're able to support us with some of our HIFIS and data related situations that we're working through, and in our efforts to improve and do things as best as possible here. So thank you again for coming on. Thank you to everyone who tuned in today to listen and to hear part of our conversations. I will be back tomorrow at 12 p.m. Atlantic again, and we will be talking about community collaboration and training and assessment with Jacinta Brown from the Community Outreach Center. Ali, thanks again for joining us, and we'll talk to you later on.
Yeah, thanks, Josh.
All right, take care.